questions. I think what we'll do first is just kind of do a brief overview of how it works, and then I'll ask Dr. Nelson some questions, and feel free to chime in with questions. So let's get started. Dr. Nelson?
I'm going to give you a brief thing. This is
Okay.
a big deal.
Good. Yeah, it's a big deal. It has changed our lives.
So many people are watching this need to understand where this came from. The original stem cells were actually developed by two professors at Wisconsin and one from Canada.
Mm-hmm.
Foltz, Davidson, not me, I wasn't around then.
Right. 1929, Dr. Davidson.
1929. Now, the Norwegians got a hold of this research. And the doctor's name was Jodin Eskelin.
Okay.
In the Department of Food Science and Agriculture in Norway, probably also. And they started to figure out that this would increase the development of normal cells. Now everybody listen, normal cells. If you regenerate to normal cells, the cells can't get sick.
Right.
That's the entire premise, and it's turning out to be true. So the big thing is that it's harvested from 9-day-old chicken embryos, which means they raise them in a controlled environment. They have no time to get sick. They're not exposed to any toxins to get sick. Inventors say Norway is a heck of a lot cleaner than the air in this country.
Yeah.
So it's got amino acids, peptides, proteins, nuclear polypeptides, all essential elements to start new life. Now, what people don't understand is this. You don't make DNA. This makes the production of tRNA, transfer RNA, and mRNA. Then, as cells become healthy, it gets converted to DNA. Now, I've had people with bad mold and all kinds of infections like this, and we're on this stuff for about a month. Their pain and their sensitivity start to go down because healthy cells don't hold disease. That is, this is not a premise. This is well known. Okay. The great thing about this stuff is it's in capsule form. I've had people heal leg ulcers. I've had 5 patients that put their kids on it for ADD, ADHD, and it takes time for those kids.
Mm-hmm.
But that you'll start seeing developmental changes within 90 days to 6 months. And if you expect something quicker than that, it isn't going to happen.
Not on ADHD or in children when we're looking at learning disabilities and things like that. We are seeing repair muscle fiber, tissues, cartilage, things like that, and we're seeing repair there really quickly in some people, a couple weeks even.
The other one we're working on is taking time, 6 or 8 months is cataract.
Okay.
And they actually start to get better.
Right.
So I'm going to do this real quick a minute. So you want to increase nucleopolypeptides, oligopolipeptides, growth factor. It's got to be able to cross the gut wall, which this does. But this is not injectable. By far and away, as a general stem cell supplement support, this beats any injection. Now this is not getting an injection for a knee.
Right.
This the messengers go to every cell. So we just had a guy here a little while ago, had a knee replacement, it failed. He's been on this for 3 weeks. He doesn't have any more pain in the joint as it up. So you want to regenerate tissue. Now, harmonic, remember, all energies nucleopolysaccharides is about 95.2 hertz. Now, if you want to tune up the chakras, we're not going to go to the chakras tonight, you can get up to 528 hertz over time.
Okay.
Because as you rebuild the cell, in the simple sense, that kicks the disease out.
Right.
Yes, these do work for people that have issues with chronic pain, etc., etc. The difference is, if you take this for 3 days, there's a pain going to get away. You're not going to notice anything for a couple of weeks, but when you do, it'll start to happen in your nose.
So we're seeing things like brain fog decreasing,
Yeah.
energy going up, anxiety decreasing, and that's happening fairly quickly.
Yeah.
Why is that?
Because the way this is structured, it gets across the cell wall and gets into the blood-brain barrier. That's
Okay.
why. This
Okay.
actually, I think, and our research staff thinks this crosses the blood-brain barrier. It has to, if they're explaining better memory.
Right. When we see things like people having ACL surgery and repairing really quickly on this, my best friend has no cartilage in her knee. She's a disabled veteran. She can bound upstairs. She's even running now, not using her brace to work out. And she attributes to this being the only change. Why is that happening?
Again, this is a patented formula. There's only one place you get it, and Julene can explain. Give me your phone number.
Mm-hmm.
Julene will explain. You can go to the internet, and you can find garbage.
Yeah.
I had somebody that bought some from Swanson or something else.
Well, those are, and they're laden. They might have a little bit of the tissue extract that we are 100% of. They might be a portion. They might have a percentage of it, but then they've thrown in a bunch of amino acids, and they've made that sound really, really important. You can get your amino acids somewhere else. If you're going to bother to take a supplement like this, you want 100% of this tissue
And
extract.
actually, there are amino acid precursors in this. The thing that people don't understand, all those other products are diluted. This is not. That's
Right.
the biggest thing.
I'm going to read somebody's question. I'm going to read some people's questions right
Perfect.
now. Rachel says, Rachel Luke's Finical says, heals osteoporosis, question mark.
It can. I'm telling you, people with bone stressors, like bone contusion from accidents or something like that, yes, it can. Is it? Look, all you people think that's going to get rid of pain in 24 hours. It's not. But you should notice something in 7 days.
So is that when she asks, is that why my stress fractures have gotten better?
Yeah.
I had real bad stress fractures. If I tried to walk too fast, run, I'd feel it the next day. I could hardly walk. That's gone away. I've been on it for 6 months though.
What about knee replacements? Cherie says.
Same thing. Same. You have to understand, folks, that stem cell is not a measured molecule. Everything is measured in energy, electronics. And as long as you understand that the cell functions off electricity, and these little immature cells actually cause the transmission of normal electricity to the cell. If the cell gets charged up, it's going to accept something that'll heal it.
Patty says, thanks for that, Doc. Patty says, does this help with detox of mold, metals, viruses? Question mark.
I just told her. Here's the
Can you
deal.
say that again?
Patty, here's what you need to understand. If you guys are in the one-size-fits-all business, this night you're going to be your answer. But if whatever you're taking, assuming it's not crap, from which most companies sell crap, this is not. Presumably, as you regenerate the cell, this will help. You're not dealing with the mold. You're dealing with the damage from the mold. The healthier the cell gets, the less it's going to hang on to the mold and all the other aflatoxin and all the other junk that's out there.
So is that why, as I've taken your supplements and added this to it, I've been able to recover from all the symptoms that mold and toxicities, mycotoxins, parasites, and whatnot caused me. It's my healthy cells going in and repairing that, like maybe other people already have, that I to fight these things off. Not everybody gets sick from this stuff. I did. A lot of you are.
Scott's chiming in. Scott's our compadre here and works with us, and he's asking. I think he's asking on behalf of somebody else because I saw that question earlier. He says, "What about what if the person's allergic to eggs?"
If your doctor is a good history taker and he's making you fill out a food diary, or if you get nausea or hives from eggs, probably. But remember, the majority of this is the albumin, not the yolk. So it's hard to test that. I have had 9 people had said they were allergic to eggs and they did not react to this.
Right.
I think it's a little bit overblown. It's like your amateur doctors, even MDs or nutritionists saying, this is great, let's run around town. Don't eat eggs because you won't heal. That's the biggest pile of bull crap that there is. Egg, which your mother told you, is the most nearly perfect food.
It is. A chicken egg is. Why is that one of the most nearly perfect foods for us?
Because it's got all the amino acids, it's got the minerals, it's got sulfur, it has everything in it.
And my understanding is you always say that a lot of the allergies come from bad livers anyways, right,
Oh,
Doc?
bad livers, yeah, but this is not. If a 9-day-old embryo, the chances of the allergen developing from that embryo are very, very small. Now,
Therefore
if you try to extract this from adult eggs, you may have a whole other problem. The adult eggs will not work for this.
One thing for everyone to keep in mind, if they order this product and have a reaction of any kind, or take it for a month and feel that they didn't see the results they wanted to see from it, the company will refund all of your money.
Yeah, they will. I know these people at this company, and I'm going to tell you, they're very credible and they're the real deal.
Let me ask you something, guys. This is a question I guess I've had. Does QVC sell this product?
I don't know.
Well,
they don't sell this.
QVC does not sell this. No way.
They sell a lot of, they sell a lot of Me Too stuff.
Yeah, QVC may have something that has some similar extract to it. Again, we go back to all of those products that are watered down with lots of junk. This is very, very expensive to produce. And we're really blessed right now because this is fairly new to the American market, and we're getting it when demand goes up, the price is going to go up. It's very expensive to produce, and so other people are out there trying to
mimic this.
They're trying to mimic this a little bit, but they're coming in with a product that has a little bit of this extract and a whole bunch of other stuff.
You're not going to get the results. You wouldn't even think about it.
You're not going to get better on it.
Where do you get it, Christy? Majeski Muller is asking.
I can help you with that. You can call me.
Number?
I'm at 505-321-1424. You're also welcome to send me a message in Messenger. I can send a link, or I can take an order over the phone, whatever's easiest for you.
We close this up. All I'm trying to get you people to understand is a milligram or a gram has nothing to do with the human body. It doesn't have a gram meter, a milligram meter. It doesn't have any of that. Yet the pharmaceutical industry has to do that for manufacturing standards.
I'm sorry to interrupt. Can you repeat the phone number? Because I got some people asking.
505-321-1424. And again, my name is Jillian McCarty.
Scott's saying her number is posted in the group.
So there it is.
Yeah, I'm an admin of the group, so everybody can reach me pretty easily. And I'm glad to answer questions if I can. The website has quite a bit of information as well. There's a PDF I can send you. But he's the expert on this. He's researched it as much as anybody in this company. And
I was one of the original guys. The owner called me and said, "You got to try this."
Well, you're taking. Show me your hair. Tell him about the hair.
Well, my hair's filling.
I mean, he had bald hair and he had no color.
Bald head.
Oh, bald head, whatever.
Bald head, and the hair came back.
And the hair came back. Look at that color. Look at that color right there.
So it is coming back.
I mean, and some of the things is kind of silly. Like, women are out spending, $200 a month on their eyelashes, which that's not something I would do because I was more worried about getting out of bed 6 months ago. However, one of the benefits of this is better skin, younger skin, weight loss, more muscle, and eyelashes. I don't know where they came from. I have about 6 times the amount of eyelashes I had before. What that proves, while trivial, is the cell regeneration that we're getting from this. And that's happening throughout the whole body.
I had one girl said to me, "I'm taking it and I'm getting more hair, so I have to shave my legs." I said, "Okay, I'll send you a couple razors."
Yeah, that is actually true.
It is true.
Yeah.
And hair other places. But
yeah.
You need to understand that the nucleopolypeptides and the part of the protein have to regenerate in the cell for anything to get repaired and grow. It's not like taking a some toothpaste and putting it on your tongue. This has to go through gastrointestinal absorption.
One more thing. If anybody's knowledgeable about stem cell transplant, there's a few doctors within the company that all consult with you that do stem cell transplantation, and they have all of their patients on this instead now and like it better.
Right.
And we're talking, this is $89.95, whereas stem cell transplantation starts at $15,000. Why is that? Why is it better?
Why is it better?
Mm-hmm.
You got all the energies.
Okay.
You need to understand. How do I say this? The process with which to isolate stem cells from a human, you're assuming that the cells in the human are not sick. Well, they are. Everybody's
right.
Okay. So the process to fractionate it and put it through a special process to get it into syringe and make it sterile, that's what makes it expensive. But
and it's not perfect.
It's not going to be perfect.
Right.
Now, if they were to take this and get an injectable form from the 9-week-old embryo,
yeah,
you pay $50,000 for that because 1 or 2 injections it would work.
Right.
It's not economically feasible.
Right.
So, because you have a chicken egg embryo that's 9 days old, it can't get sick.
Okay.
It can't have toxins and altered DNA because of the way the Norwegians grow it under controlled conditions.
And it's highly controlled.
Oh, it's highly
Highly controlled. That's another thing to look for if you're looking at anything similar. We know now that there's a couple different factories that are trying to replicate this, and they're not using the controls that the Norwegians are. And it's not coming from this scientific mecca where these come from.
No, but we also have control of the source.
Yeah, and we do have control of the source.
We have some really important. That's good. So we have control of how we make it.
Well, we have control of how it's made, how it's harvested, and that it's a clean product coming to us. Right?
We have younger kids because they're autistic or ADD or whatever. They won't take the capsule. You can actually take the capsule, take the powder, put it in a popsicle mold and make popsicles for them. That will work. Or the kid doesn't like the taste. Mix it up in applesauce or pudding. Who cares? The delivery mechanism would be almost identical as long as you mix it up like that. Within 24 hours, you give it.
We have a lot of good questions on this group. I think, and we're getting flooded with them. I think that. What do you guys think? Do you think it would be better for them just to post those questions and then you can jump on the group and answer them and talk to people one on
I'm
one?
glad to, or we can answer a couple.
How many
It's up to
questions
you.
have you got?
Quite a bit. We got quite a bit coming here.
Okay, I'm going to take the top 5.
All right. There was one
And
person
after
talking about.
that, you're on luck. Because I've got
We're really
15 more patients to do yet.
So one person is asking. It looks like she's trying to figure out about knee surgery versus taking this product. Knee surgery, not knee surgery, but stem cell surgery for knees.
Well, there's no guarantee it'll work.
Didn't we have a patient at one point
Got 4 of them.
that it didn't work?
The major stem
my best
cell.
friend did it. It didn't work.
What happened?
It just didn't work. Yeah, she didn't see the regeneration with the injectables. She's been through all kinds of stuff. She started taking this. She's running. She's not wearing her brace.
Okay.
So
What's her name? What's the person who asked the question?
It's Shaima Ali.
Shaima, if you don't try this for 3 months before you want to entertain getting an injectable stem cell transplant, you not only need to be shot, you need a brain transplant.
oh.
Yeah, because
Well-
I've got the experience, I've got
Yeah,
the
he knows.
credentials.
He
I
does
know.
know.
Jolene knows. I have patience in it. Why would you spend anywhere between $15,000 and $25,000?
It's actually my bad. It's not for knees. I was thinking of one of our patients, but it's actually for MS.
Okay,
It's a little bit of a
this
different
is-
animal.
This is the research that has been done so far. Obviously, MS is, again, a bunch of infections. It can also be a genetic error. Is it worth trying for 90 to 120 days? Yeah, what do you got to lose? Is this company going to do the clinical research on MS? No, they're not, because if the feds get their hand on it, they're going to turn it into a drug. And then it's going to ruin it for everybody.
Yeah, true.
Joshua, which we've kind of briefly spoken with, but I don't think he's still, you know.
He's on the fence.
He's asking a good question. He says, you know, anybody with mold and Lyme seems to be, they've gone through the hellhole, trying to get better. It's very tough conditions to recover from. He says, does it help with mold/Lyme toxins?
I just answered it.
So again, it helps.
Again, you
the
have
healthy
a
cells
toxic
take over.
cell. If you start rebuilding, reinitiating the normal RNA and DNA in the cell, presumably you're going to get better. Now, listen to me. There are a lot of major universities that are doing research on the top three is Stanford, Wisconsin, and University of Miami.
Okay.
They can't even make claims about injectable stem cells. How the hell can we? You just can't. That doesn't mean it won't help you. What's $90 a month for 3 months to find out?
What it definitely doesn't mean is that it hasn't helped a lot of people in your situation. I was in your situation. It helped me. We have quite a few patients that are taking this. It's helped to them.
The other question, obviously this is going to be more of a liability question. Can a 2-year-old neuroblastoma stage 4 patient take this versus the one oncologist gives?
Nobody knows the answer to that. I would say, first of all, if there's a neuroblastoma, you need to get a hold of me. We have protocols for that stuff.
Right, and then you got to sign a cancer exception form.
I think there are other ways to approach a neuroblastoma. There isn't anybody, the company or otherwise, that's going to believe in enough credible entity to say to give this to this kid.
Right. That's not something I would feel comfortable ever doing.
Yeah, that's too much of a...
Unless the neuroblastoma had a genetic precursor, they did the genetic testing, other than 23andMe, which is a bunch of crap, okay? There's nobody going to tell you that it's going to benefit this kid. If this is a series of toxicity issues, then you get a hold of me, get a hold of Nick, get a hold of Janine, and they'll tell me we can start doing something.
Get a hold of Scott.
Get a hold of Scott.
Yeah.
What if someone with MS is on drugs takes it? Will there be interaction?
No.
That's an important question for all medications.
No.
Fibro, mold, whatever you're doing with. We're not seeing any, and he can explain a little bit, we're not seeing any problems with taking this and the medications that you're on.
Because you're not giving them the milligrams of the drug. You're giving them the energy of the compound. It's completely different.
Completely different delivery system, right? Okay.
Yep.
I think that's it.
All right. Any other questions
Any
anybody
other
has?
questions anymore? No.
You can post them. You can send them to me in Messenger, whatever works for you. Again, my phone number is 505-321-1424. And I look forward to working with you. This has really helped a lot of people.
People with memory problems, Alzheimer.
That's the question I had is, what has been your experience with people that are taken under your wing, Jillian, that have depression or anxiety?
Well, I was one of them. So a couple people that are in recovery are taking it. These are people I know really well, with huge anxiety issues, just plagued with it. Anxiety many times causes depression because of the cycle of it. Anxiety is going away. There's a number of us, like a dozen of us, and you can even talk to a couple of them if you'd like to, that believe that this is the best thing they've ever taken for anxiety. Depression goes away, and there's an uplift in mood that happens with all of it. I don't know why or how that happens, but it's there. Some of it's the energy we feel. I was bedridden 7 months ago.
I just took it today. You gave it to me today. I suffer from anxiety and depression. I feel better.
There's a sense of well-being. It's kind of I liken it to how I felt in my 20s before I was smart enough to understand all the problems that I had. You just feel better, and I'm not sweating the small stuff. So the anxiety and depression is huge with this.
This really has to do with how you make and distribute and metabolize neurotransmitters.
Okay.
Epinephrine, norepinephrine, GABA.
What is this doing for dopamine?
Huh?
I know I'm wearing you out.
Presumably, it would balance it. I don't think we're done completing that study yet.
Okay. Okay.
Also, people with addictions. We're trying to get out of addictions. This will really start to ameliorate them going back to the addictive factors.
Okay. Makes it where, I don't know, I was suffering from, I decided to go off of all of my medications. It took me 2 years to wean. And before I met Dr. Nelson, had just a lot of problems. And I think it was because of the damage that those medications did. Between this and the supplements he had me on, that's gone away. And that's huge. And I know a lot of us are in that situation.
Like I said, I can be as good a salesman as anybody.
Mm-hmm.
But I'll tell you, for what, $90 a month, $95 a month, and you buy it, and you know, guys, you got to give it 90 days. You'd be foolish not to.
So, and what's our motto? We're in the.
I don't know. What are you telling me?
We're in the results business, right?
Yeah, the healing business, and that's what this is about: is healing and results. Again, if you don't like it, the company that makes this will refund your money. Empty bottle refund. So
I think that's it.
I think that's it. We try to get across it. We need to understand.